recording?
Yes.
Yeah,
Oh,
there's
good.
like a
Yes.
bar across the top. It's like
Oh, okay.
you're consenting.
Oh, okay. Gotcha. Okay. All right. So we know our job as a nurse. We need to take care of people who are sick. We treat them holistically, which is very different from the doctor's role. Um, we treat all aspects of the patient, physically, emotionally, mentally, everything. Um, we protect them. We're an advocate for them. Um, we take care of people of all ages. We can take care of little tiny babies. We can help bring babies into the world. We can take care of older adults. We can take care of people when they're dying. We can be hospice nurses. We can do a lot. It does require that we are educated. So we have to have an education in art and science. Obviously, for an LPN, you will complete this program to get that. If you wanted to be an RN, you would have an associate's degree in nursing. So according to the American Nurses Association, their definition of nursing is that professional nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, and alleviation of suffering through the diagnosis and treatment of human response, and advocacy in the care of individuals, their families, their communities, and populations. And that's very accurate. The International Council of Nurses, they define nurses as encompassing autonomous and collaborative care of individuals of all ages, their family members. Whoops. Oh, God. Now I lost my spot. Communities, groups in 6 centers, in 6 settings, or in well settings. They believe that we promote health, we prevent illness, and we care for the ill, the disabled, and the dying. We advocate environment for our patients. We contribute to research, and we participate in shaping health policy and in patient health systems management and education. These are all part of our nursing roles. So we know that nursing is extremely deeply rooted in history. We've come a long way. We talked about this in 103. We know that by learning about the history of nursing, it's going to provide us with a good understanding of how things have changed over the course of times and how, it's helped improve the art of nursing. And it puts us into perspective of how to how to use those guidelines and evidence-based practices that we've developed to help guide us in taking care of our patients. So we know back in the ancient civilizations, back at that time, there were certain guidelines for behavior. So we knew that they developed these guidelines because they wanted to protect their people and they wanted to guarantee survival among certain groups. They also decided we're going to make rules for certain behaviors. So they decided to govern sanitation. They decided to govern how people would take care of themselves hygienically. They also dictated sexual relationships, how they would eat, if they would take care of themselves, disease, and different areas. Once during that time back in Egypt, they were known to have started the earliest version of what we call community health laws. So basically deciding what we could do in our communities and trying to govern what people could do and how they would act. In Egypt during that time, there were physicians that they called them that could treat different fractures. They could help repair teeth. They could give different drugs to different people. They classified different drugs and decided that this drug would be used for pain. This is the medicine that we would use for infection and things like that. And then during that time when women were giving birth, they had what they called today still midwives, and they would help with the obstetrics portion and help deliver the babies and take care of the mom. In Babylonia, this is where they decided that they believed that anybody that got sick, it was a form of punishment. So it wasn't something pathophysiologically that was happening with the body. It wasn't from infection or not following evidence-based practice or things like that. It was because you were not a good enough person at the time or you were committing sins. They said that they believed back then that it was possible to achieve atonement, but you had to purify your body and you had to use certain herbs and do certain chances that they deemed as acceptable. Then we have the Old Testament. The Old Testament was known to talk about different dietary restrictions. It talked about different ways to with regards to controlling hygiene and isolating certain infections and illnesses. It also talked about caring verses in there that talk about how they would care for the elderly adults. And we saw the beginnings of some health laws during that time. One example of one of the restrictions that they put into place, or one of the community rules they put into place back in the Old Testament, was that it was forbidden to eat meat after the third day of the month, because in a hot climate without refrigeration, the meat would spoil. So as you can see, even back then, they were kind of starting to do what we call evidence-based practice. They just didn't know it was evidence-based practice, but they would put two and two together and probably notice that if you ate meat after a certain number of days and it wasn't refrigerated, then you got, and some type of an illness. So even back then, we were still starting to see these signs of this evidence-based practice. Still during the ancient the Vedas, these were considered, the Vedas are very sacred books, Hindu books that are found in India. They're books that told about different surgeries, so major surgeries that are pretty complicated, very minor procedures. They talked about urinary system diseases. So this is the time where they were really starting to look at medical implementations and diseases and things like that. And they started to keep a note of what they were discovering. Then in ancient China, this is where we see that acupuncture comes from them. It started way back when in the ancient civilizations, and it is something that we use today. They also started implementing some of their medicines that they created and contributed to major drug advancements throughout the time. In Greece, back in Greece, Hippocrates was back then was considered a Greek physician. They also called him the father of medicine. During that time, anyone that was in Greece that became a physician had to take the Hippocratic Oath, which is what we still see today in practice with all of our medical school graduates. They have to take that Hippocratic Oath before they can practice when they graduate. This is where we start to see, during this time in Greece, we started to see medicine shift from what they believed, and they made up to a more scientific belief, more of that evidence-based practice. They believed at this time that illnesses and diseases were not because you were not living your life the way you were supposed to, or because you were being punished. Now they were starting to correlate diseases and infections with specific causes. So maybe their environment or infection or things like that. So this was really where that evidence-based practice, what we have today, started to take off. The majority of care that was given to patients during this time was given by men, not women, because back then they believed that women were not worthy of any medical or nursing. Still during the ancient civilizations in Rome, they believed that medicine was based on superstition. They had different military hospitals for their military, and they would care for those, for the people, the wounded soldiers. During this time in Rome, even though in some other areas of the world, women were not seen in this light, but in Rome, they did hold their women to a higher, greater esteem, and they did allow them to care for people in like a nurse's role. And organized care, was not yet established in Rome. So they cared for people, but it really wasn't considered an organized type of a nursing care. Then we're going to move on to the early Christian era. This is where our men and women, we call them deacon and deaconesses, were considered an equal rank. So one wasn't better than the other. And what they did is they served the church. They took care of sick people. They took care of poor people, older people, orphans that didn't have any parents. They did what they called work of mercy. This is where they would go out into the community and find people that were needy, that needed food and clothing, and they would help take care of them and give them what they need. They took care of burying the dead that didn't have any family members. They went to the prison and they visited the prisoners. Then during this era is where we started to see them start to organize this public era of like health nursing. So it was called the Order of Widows and the Order of Virgins. And then Fabiola founded the first public hospital. So this is a woman who cared for the sick and injured, and she often cleaned and dressed sores and wounds with her own hands. So this is where we're really starting. We formed this public hospital, and we're starting to put all the pieces together, and we're starting to form these, public health nurses, where people were actually recognized as caregivers for people who were sick. They didn't have the name of nurses. Then during the early Middle Ages, we saw that medicine and health was associated with different religious groups. So it did take a little bit of a turn. We found hospitals that were founded at monasteries. There was a big shift that now we started to focus on personal care and comfort. So not only did we look at the patient being sick and we weren't looking at infection and medication, we were also looking at how paying attention to their personal needs and making them comfortable in their environment, how that is also going to affect their healing and how well they, heal. The first nursing order of the nuns was the Augustinian sisters, and they staffed the first hospital that was located in Paris. The High Middle Ages, we saw the collapse of the Roman Empire. A lot of things were greatly influenced by the church at that time. Everything, almost every aspect of their life, nursing, art, agriculture, all their every day-to-day activity was influenced by what the church. So the church ruled everything. Then we saw the development during this time of the Crusades. So what the Crusades was responsible for was they went near the battlefield where soldiers were, and they developed hospitals so that they could care for them. They also developed the insignia of the Knight Hospitallers of St. John of Jerusalem. So they were responsible for taking care of sick people during that time, and they had a big bright red cross, and that would continue to go on through time as we know it. And now it is actually the symbol of the International Red Cross, but that's when it started during the Crusades. We also saw the development of hospice during that time. So hospice wasn't back then what it was today. There certainly weren't as many restrictions, a lot of variables, but it was just established within monasteries, so it was inside of the church. It became a refuge of safety for a lot of different people. There was a lot of different people from all around that could come, people that were poor, people that were sick. The first order of St. Francis was founded by St. Francis of Assisi. Then we had the second order of St. Francis founded by St. Clare, and then the third order of St. Francis. So this was founded by just ordinary, everyday lay people who wanted to follow his teachings, but they didn't want to give up their normal life. So with the first and the second order of St. Francis, there was a very strict guideline that you had to live a certain way and you had to do a certain thing and you had to follow these rules. With the third one, not so much. You could still follow the teachings that they believed in, but you didn't have to have that discipline that you did with the other two. Then we saw that nursing orders, how nursing orders and church influence impacted each other. So during this time, the church started to develop and encouraged the development of nursing orders. They expected that these people would basically, kind of like you do when you become a nun, that you would dedicate yourself to this lifestyle, that you would always agree to be obedient to the nursing profession, that you would agree to take care of patients, and that you have to perform, you have to be devoted to this profession. The church decided that they were going to favor nursing over medicine, which we know nursing and medicine are two different things. So nursing really was that one-on-one care that we provide, and that was what they chose to follow at that time. And then we see where it became a more acceptable occupation for women in the church's eyes. Then we have the Renaissance time. This is actually where we just thought during the last period that nursing was starting to become more developed and there was more of a acceptance for women. Well, now during the Renaissance period, things start to change again a little bit, and we have the decline of nursing. So we saw that society during this time was very heavily with famine. There was a lot of poor people. A lot of people didn't have food. They didn't have shelter. They were very, very sick. They started making new science and new discoveries and new exploitations, but they thought that they were different than nursing. They were more medical. So we see at this time that medicine takes a lead among the sciences, not so much the nursing anymore. So they were really looking at that anatomy, the physiology, and that scientific basis. And then nursing definitely took a decline. So we have the Reformation from the 1500s to 1600s. This is where all the monasteries were closed. Martin Luther ended dominance of the Catholic Church during this time. During this time, there was virtually no nursing at all. Everything had been completely abolished, and that stays in effect until the 1820s. During this time, women were more considered subordinate to men. So men were definitely the dominant sex. Women definitely were not caregivers outside of the home. They were expected to stay home. They took care of the home. They cooked, they cleaned. Their job basically was to bear children and raise children. And then 1633, St. Vincent de Paul, who was a French priest, and Louis de Marillac founded the Sister of Charities. And we'll talk a little bit more about that. So through the 18th, the 19th, and the early 20th century, we see that industrialism replaces the agricultural society very slowly, but it does. Remember, we had very unsanitary living conditions. There was a lot of poverty, a lot of famine. The sick, the insane, the poor, and the homeless were put into hospitals because the streets were just overrun. So they had to develop areas where they could house these people. So they developed poorhouses. They put people who didn't have good hygiene and that were sick into the hospitals, the homeless, and the people who had mental issues, asylums, and the poorhouses. Then during this time, we saw that Londoner John Edwards decided that he wanted to, he was concerned about all these issues with the public and the unsanitary conditions and the unhealthy living facilities. So he decided to make reforms in public health. So he wanted to see that even though we had people that were in prison, that he didn't like the way that they were living. So he called for prison reforms. He wanted to put more of a emphasis on public awareness to try and prevent people from doing things that they would end up in prison. Then we see that Elizabeth Fry organized the Protestant Sisters of Charity. So she basically was one of the first people to provide nursing care again in that aspect when she took people in London. And then we have German by the name of Theodor Fiedler. He opened the Kaiserwerth Deaconess Institution, and this was actually the first real nursing school. Now we're going to continue through these centuries. We're going to talk about Florence Nightingale. We know that she was like one of the first nurses. She was born to a very, very wealthy family. She is actually considered the founder of nursing. Her family was very, very much against her becoming a nurse. During a nurse at this time, you weren't seen as a good person if you became a nurse. This was just a profession that poor women and people born to poor families would become. It wasn't accepted. It wasn't looked upon like it is today, but it was in her heart to become a nurse. So she went against her family and she decided to be a nurse anywhere. So women that entered nursing were typically from those poorer families, and they were considered to have low moral standards. She helped transfer nursing from a profession that was thought to be just by these poor women to a very noble occupation. She was responsible for that. She created nursing and made it what it is today. She believed that it was her divine calling, that she was born to do this. It was definitely her passion. She went in in 1853 to Paris, and she studied with the Sisters of Charity. She believed that a nurse should be very educated, very self-disciplined, very moral, and that you should never stop learning. And that really is what nursing is today. There is a huge push to be very self-directed. We have a lot of autonomy. We have a lot of things that are expected of us. We have to work very independently. We should never stop learning. Because nursing is evidence-based practice, we're always learning. No matter what degree you have, you're always going to be learning. She used scientific research to demonstrate the need for reform. She did a lot of work with hygiene and sanitation and the patient's environment, and she developed a whole book about how a patient's environment affects their healing. She was considered a heroine of the Crimean War, and she was also called the Lady of the Lamp, because when she was taking care of people in the hospitals where the military were, she would go around in the middle of the night with her little lamp, and that's how she would check on patients. She would carry that little lamp with her everywhere she went. And that is actually what you guys get when you graduate. I still have mine actually from when I graduated nursing school. This is the lamp that you get when you CCBC with your LPN. This is actually the Florence Nightingale lamp. So you guys will get that when you graduate, and that is significant of Florence Nightingale. So what contributions did Florence Nightingale make? We talked about a couple of them, but she definitely established standards for public health and hospital management. So like I said, she made a lot of notes when she was taking care of patients, and she would really put together this scientific based information, looking at patients, what type of infections they have, looking at the conditions in which they live in, looking at their environment, how does it affect healing? And then she was able to create this set of standards, which developed even further, but we do follow those now. They help guide our, our formation of the nursing career. She brought about many major reforms in hygiene and sanitation, so much as that she made a remarkable decrease in the mortality rate of the patients that she was taking care of. She believed that nursing was based on trial and error. And basically, that's that evidence-based practice. That's how we come to get evidence-based practice. We try something, and then we try something else until we fix it. She wrote notes on nursing. This is actually a book today that's still published. If you wanted to buy it, it's pretty interesting. She developed the first organized program for training nurses at the St. Thomas Hospital in London. And then she recognized two components of nursing. The two most important things are health and illness. And we did talk a little bit about that yesterday, how health and illness are on that continuum, that sometimes we stay healthy for the longest period of time, and sometimes we dip down into that unhealthy, but then we should always go back up again. But health and illness definitely is on that continuum. And then she was responsible for that nutrition is important to health. And we know, we've talked about this since funds, how important it is to have a good diet, protein and certain amount of carbs and stuff like that, so that we can fuel the body to help it heal. So in her words, Florence Nightingale said that nursing is an art. And if it is to be made an art, it requires an exclusive devotion, as hard as any preparation as any painter's or sculptor's work. And that is true. Definitely need devotion if you're going to be a nurse. It should be your passion. We saw the development of the International Red Cross. We talked a couple slides back, how it started way back when with just this little tiny Red Cross. It further developed as the years go on. And there was they developed rules for caring for certain people that were injured during the war. They also took care of the people that were the medical personnel that were taking care of the sick people. And they also helped fund the hospitals and created some guidelines, and they helped establish rules for treatments of wounds. So they looked at infection and antibiotics and things like that, and they kind of started forming that evidence-based practice of, hey, this is how we should take care of this. This is the minimum requirements that we need for our medical personnel and what we should have in these hospitals. We had a lot of scientific developments during this period. We had a person by the name of Philip Semmelweis, which developed the childbed fever. And he he figured out what childbed fever was. This was something that was taken over children way back when, and they couldn't figure out what it was. He was able to do research and figure out what it was, and then he was able to develop ways to prevent it and from happening again, and he significantly reduced maternal death rates. Then we saw Louis Pasteur. He created the pasteurization process. Joseph Lister during this time created that aseptic surgical technique, which we definitely have expanded upon and we use today and every day with our gloves and how we clean wounds and wash our hands and things like that. And then Robert Koch was responsible for developing the germ theory. So during the Civil War, things started continuing to increase for the good of nursing. The Civil War decided that they needed skilled nurses, that they needed people that were trained and knowledgeable in taking care of people every day to be able to meet the needs of all the sick. So when they started showing a need for more skilled nurses, this helped contribute to the growth of nursing again, and then in the United States. So it also improved the status of women. So we weren't thought of as, the poor people that were just providing nursing care. So we saw that during this time, Dorothea Dix was an educator, and she was also someone who volunteered as a nurse, and she served as the superintendent of the Union Army for female nurses. Was very instrumental in providing mental health care into our community. So she was very passionate about patients that had mental health illness, and it was very important for her to make sure that those people, because they were at a clear disadvantage mentally, that they were treated humanely. So that was her passion, and she made sure that she brought awareness about mental illness. She created a lot of guidelines about how we should treat people that have mental illness, and she was instrumental in putting more resources into the community to care for patients that had mental illness in the community instead of putting them in a hospital setting. Then we saw Harriet Tubman, who was a phenomenal nurse and abolitionist who took care of soldiers in the field and helped free the slaves. During this time period, we also saw the emergence of American nurse leaders. So during this time, we saw like a lot of creations of different organizations. So American League for Nursing, American Nurses Association, things like that. Nursing started to have their own organization. We saw that there was a big upswing for research because of the evidence-based practice, and a lot of different organizations contributed to that research. We saw the development through evidence-based practice of some of our theories of nursing that we have today. We looked at segregation in nursing education and the workplace to make sure that things were fair and equal. There was a big push to improve nursing education, and that push has never changed. So when I graduated from CCBC 9 years ago, it was just expected that we would get our bachelor's, right? When I got my job at GBMC, they made me sign a paper saying you have to get your bachelor's. Well, now I feel like the master's has now turned into the bachelor's. Like the master's is just the bare minimum. They want you to continue always in order for us to be able to, there's definitely correlations between the level of care you provide with the more education you have. So if you do research and you pull up scholarly articles, and if you compare a patient that's cared for by an associate's degree nurse with a patient that's cared for by a bachelor degree nurse or a master's, there's higher outcome levels for the patients that are cared for by degree nurses. So we always need to continue with nursing education. During this time, we also started taking nursing care out of the hospital setting, and we moved it into more rural areas that didn't have access. And we started moving it into our community and saw more of a push for this public health nursing. And then this is where the nursing profession really was finally, for once and for all, considered a respectable profession. Clara Barton was another important nurse leader. She was probably the most famous nurse that was never a nurse. So she never had any particular training. She never went to nursing school, but she did practice as a nurse. They used to call her the angel of the battle. She would help organize aid to all the soldiers during the Civil War, and she would work in the field hospitals during the Civil War. And she established the Red Cross in 1992. Linda Richards was our first American trained nurse. She attended the New England Hospital based on the theories of Dr. Nightingale. She was the very first nurse that was trained in the US, and she developed a system for writing accurate patient reports, which remains the basis of our healthcare system today. So basically her documentation, that's what she developed. Obviously it's changed a lot and we've made a lot of improvements, but she was responsible for creating that. And then she also established the first nurse training program in Japan. And then Mary Eliza Mahoney was the first African-American graduate nurse in the United States. She was responsible for integrating, retaining, and advancing minorities in nursing. Lavinia Dock, she headed the National League for the Nursing, which is still up and running today. And then she developed something called The History of Nursing, which is a volume series that has 4 books to it. Then Mary Nutting, she developed the first college-level department of nursing at Columbia University Teachers College, and she was very involved with raising standards for nursing education. So looking at what was considered an acceptable training period. How long did a nurse have to go to school? What qualifications did they have to meet in order for them to practice? Isabel Hampton Robb was the first superintendent of the Johns Hopkins Training School, which is right here where we live. She was instrumental with limiting the amount of hours in days that someone could work. So she decided that you could only work 8 hours a day in a 6-day work week. She wrote a textbook to help students learn and implement a certain grading policy. And then she advocated for educational standards and mandatory licensing, which is the license that we have, which is the licensing standards that we have today. Sitting for your board through the state of Maryland. She made sure that each state had their own licensing. She was also the first president of the Nurses Associated Alumni of US and Canada. And that later became what we know today as the American Nurses Association. Then there was Lillian Wald and Mary Brewster. They worked together and they opened the Henry Street Settlement, which is still open today and serves the New York population. What they did back then was they provided service to the poor in the community. They also coined the term public health nurse. So really making that shift from providing care into the hospital to moving it into the community, and more so towards people who definitely didn't have insurance and couldn't afford to get care. So definitely assisting the poorer population. And their goal was to improve wellness, nutrition, hygiene, and shelter. And they still provide sliding scale services today to poor people in New York. So they are a nonprofit social services agency in the Lower East Side neighborhood of Manhattan. They provide social services, they have an arts program, and they provide healthcare services to all New Yorkers of all ages. And it still continues to. We have Adele Bell Samuel Thomas, who developed the equal opportunity. She was an equal opportunity crusader for the African-American people in nursing. She wrote a book called The Pathfinders, A History to the Progress of Colored Graduate Nurses. And then Annie Goodrich wrote plans for the Army School of Nursing. So she looked at the different other publications that had been written about nursing, and she made some changes to her and tailored her just to the military. Then Clara Mass, she was one of the people who agreed to be a test subject to develop. Back then, they developed something called yellow fever, and nobody was really sure how it started and how to heal it. So she said that she would agree to be a test subject, but during the time where she was doing that, she actually died from the disease itself. Then Margaret Sanger founded the American Birth Control League. They developed the first birth control clinic in the United States, and she was the very first president of the International Planned Parenthood Federation, which is still up and running today. Susie Walking Bear Yellowtail was a nurse who worked to end abuse in Native American health. She was responsible for founding the Native American Nurses Association, which still is running today. She got the President's Award in 1962 for providing outstanding nursing health care. And she looked at overall health, socioeconomic, and educational problems within her culture. Hildegard Papalos, she was considered the mother of psychiatric nursing. I know we've talked a lot about her. She developed basically therapy and practice of mental health nursing, and she was crucial in developing the development of the client-nurse relationship. And we've talked a lot about developing that relationship in order to be able to meet the needs of our patients. Martha Rogers was the discoverer of the science of unitary human beings. She really developed that therapeutic touch and how it has an effect on our patients, how it affects their healing, their mental outlook. Mary Elizabeth Carnegie, she wrote The Pathway Thread, which was about Blacks in nursing worldwide. She initiated the Bachelorette Nursing Program of American Hampton, so she was responsible for that BSN program. And then she was the first dean and professor of Florida A&M University, first African-American dean and professor. Randolph Rash, he is still alive. He is the first African-American to graduate nursing. He was the first African-American male that served as a public health nurse. He was the first African-American man to complete an MSN as a family nurse practitioner. And he was the first American man to earn a PhD in nursing. He accomplished a lot. Adari Rhodes created the National Association of Hispanic Nurses. Rebecca Anderson was an LPN who worked in Oklahoma, in that building where the Oklahoma City bombing was, and she actually died trying to save victims. She was caught in the rubble when one of those buildings collapsed. Mildred Montag, she was responsible for actually developing this associate degree nursing program. So there's always been a nursing shortage, even back then, between 1700 or 1940. There's never been enough nurses. So she was responsible for saying, if we could develop a nursing program that was shorter, we could put nurses out quicker and we could get more of them in a shorter period of time. So she developed this 2-year degree nursing program in order to help with the nursing shortage. She decreased the length of the education by 2 years. Initially, it was 4 years. So that's how the associate degree nursing program came to play. And we still have that associate's degree nursing program at most community colleges. So just a little bit of history about the practical nursing program. In 1892, the Young Women's Christian Association in New York developed the first training program for practical nurses. So this was a program that was very different than regular nurses. There was a change, definitely a decrease in the scope of practice, but this was the very first training program for LPNs. The first official school was the Ballard School in 1897, which was located in New York. And then in World War II, what we saw, again, was this shortage of registered nurses. There's always been a shortage. It increased the need for practical and vocational nurses, such as yourself, for the LPN program. So they were taught to care for the sick in a limited capacity. They couldn't do everything that the RNs could do, that the registered nurses could do at that time, because they didn't have the same degree. But they would care for the sick, and they were taught homemaking skills. The shortage of nursing helped grow more than 260 schools for the LPN program. After education and the licensing of LPNs became more formalized. So they developed different standardizations. By 1971, the National League of Nursing really took a look at things and saw how instrumental it was in helping with the nurses shortage. So they developed a standardized education program and developed certain licensing for the LPNs. The National Association of Practical Nursing Education and Service was developed in 1941, and it was responsible for accrediting those 260 accredited training programs. So they went into these facilities and decided what the qualifications were in order to be accredited. What, you had to teach certain things, you had to meet certain aspects. So they were responsible for that. And then in 1949, the National Federation of the Licensed Practical Nurses was developed. They're both still up and running today. They work together to set standards for practical nurses, and they help educate and inform the general public about what practical nurses do and how they help in the nursing field. So if we are looking into the future, so just last year, the average nurse graduate was 33 years old. The average age of the registered nurse is 44 years old. The average age of the nurse educator is 50 years old. According to the American Nurses Association, by 2022, there will be a need for 3.44 million nurses. That's a 20.2% increase in RNs, with the demand of an additional 1.13 million nurses by 2022. I would say that this has probably changed. This is a couple years old when they were estimating this because of COVID and the loss of nurses that we've had. I'm sure that those numbers are even higher than that. By 2015, they increased the need for practical nurses in the state of Maryland. And then we saw a huge, like last year, I kept saying it was the year of the LPN, because all of a sudden everybody wanted our LPNs and they couldn't get them into hospitals quick enough because, again, they were helping to close down that gap in the nursing shortage. So we know that nursing today is challenging. It's very hard to meet the patient's needs because our society is always changing. We don't have enough nurses to begin with. We have a very chronically ill population of people. So it just and with healthcare issues and insurance issues and the availability of healthcare, it is just very hard sometimes to meet the needs that's expected of us in nursing. Nursing and nursing education is always looking at the practice and the school's curriculum, because we have to include things that come up as the years go on. So we said before that nursing is always changing. So now, we're talking about bioterrorism, because unfortunately this is the day and age that we're living in, and we're dealing with these things. So we have to know how to treat it. Disaster management, super infections like COVID, these are all things that we're having to add to our nursing education. So nursing recognizes the changes in healthcare, right? We're pushing people out the door faster. There's shorter stays because we want to pay, which means we put people back into the community. And if they don't have the resources, they get sicker and they come back to the hospital again. We see a lot of readmissions. The patients that we're taking care of are more acutely ill, more chronic illnesses. But we are starting to put that focus on health promotion and wellness. It's really the only way to solve these issues, is if we promote health and wellness. When you graduate nursing, you will be considered an entry level of practice. All right, so here is a quiz question. Medicine that takes the lead among science. When did that happen? In the High Middle Ages, the early Christian era, the Renaissance, or the Reformation?
C. C.
What do you guys think?
C.
Yes, during the Renaissance. Very good. All right, and that's all I have. I know that was boring. It's just a lot of facts. Really no critical thinking in that. Any questions?
No.
All right. Let me